Pharmacy exam multiple choice questions with their answers. So today's first question. Angiotensin receptor antagonists or blockers, that is ARBs, are less likely to cause angioedema and cough than the AC inhibitors, that is angiotensin converting enzyme inhibitors, because options are ARBs do not contain a sulfhydryl functional group, ARBs are not administered as prodrugs, AC inhibitors are more specific for inhibiting the production of angiotensin 2, ARBs are pseudo-irreversible antagonists. ARBs do not inhibit the breakdown of bradykinin. Correct answer is option E, that is ARBs do not inhibit the breakdown of bradykinin. AC inhibitors inhibit not only the conversion of angiotensin 1 to angiotensin 2 but also inhibit the metabolism of bradykinin. The accumulation of bradykinin has been associated with the side effects of non-productive cough and angioedema observed with the ACE inhibitors. The ARBs do not interfere with bradykinin metabolism and therefore have a much lower incidence of these effects than observed with the ACE inhibitors. Although the other choices are sometimes true statements, but they do not address the question related to the side effects. Which of the following diuretics does not contain a sulfonamide substituent? Options are furosemide, ethacrynic acid, torsemide, hydrochlorothiazide, bumetanide. Correct answer is option B, that is ethacrynic acid. Ethacrynic acid, which is an aryl oxyacetic acid derivative, is the only loop diuretic that does not have a sulfonamide substituent. Furosemide, torsemide, and bumetanide are also loop diuretics. The thiazide and thiazide-like diuretics also have a sulfonamide, including hydrochlorothiazide, and also contain a sulfonamide substituent. This may be important in patients with a hypersensitivity to sulfonamides, although cross-reactivity with sulfonamide antibiotics is not always apparent. Which of the following anticoagulant agents dose is influenced by genetic polymorphism in CYP2C9 and vitamin K reductase? Options are enoxaparin, fondaparinux, warfarin, lepidolin, bivalirudin. Correct answer is option C, that is warfarin, which is an oral anticoagulant. Polymorphisms of the CYP2C9 gene can result in variant forms of the enzyme with markedly altered capacity for warfarin metabolism. The reduced metabolic capacity of the variants can increase the likelihood of bleeding with usual doses. Specific polymorphisms in the vitamin K reductase gene can lead to altered hepatic levels of the enzymes such that patients with low expression can be more susceptible to anticoagulant effects of standard warfarin doses, again increasing the potential for bleeding. An unconscious patient is brought into the emergency department. The patient is given 50 ml of 50% dextrose in water, thiamine 100 mg IV, followed by naloxone 1 mg, at which point he awakens. This patient most likely has overdosed on which of the following substances? Options are methanol, amitriptyline, cocaine, haloperidol, heroin. Here, the correct answer is option E, that is heroin. Naloxone reverses the effects of opioid receptor agonists such as heroin, morphine, and propoxyphene. Contraindications to the administration of syrup of ipecac include which of the following? Options are an unconscious patient, a patient who is experiencing a generalized tonic-clonic seizure, a patient who has ingested a caustic substance, all of the above, none of the above. Here the answer is option D, that is all of the options are correct. Contraindications to ipecac include the three C's, that is caustics, conscious, and convulsions. The use of syrup of ipecac is reserved for rare circumstances and only under the direction of the Poison Control Center and or a physician. So thank you for watching. Have a pleasant day.